Yeah, I can hear you. So what I have been doing for the
I was
past...
trying to understand, Professor Saab, how come, is there some new kind of mechanism or protocol that allows the patients to go home hours after an awake operation? Because this is, first of all, a delicate operation, and secondly, the procedure is, cumbersome as well for the patient and for the doctor who's operating on it as well. What has changed?
Yeah, so let me explain myself. So the reality is, I do I've been doing neurosurgery for a certain number of years in Pakistan. And as a matter of fact, when I started here, I think 4 years ago, I introduced a concept which was called as a minimally invasive neurosurgery. And that is something like you do brain surgery or spine surgery. You do it by a small cut, very refined approach, very focused. And when you do that, then the patient does not tend to have that much pain. And they have a small cut, their recovery is sooner, and then they tend to go home earlier. So when I came to Pakistan, the reality is the brain tumors were like staying in hospital for like up to 5 days, up to 10 days, with 1 day in surgical ICU. But with minimally invasive neurosurgery, I gradually reduced the stay of the patient to, for the past year, I've been doing brain tumors which have been going home within 24 hours. But then the reality is, I also introduced the awake brain tumor surgery, in which patient tends to be awake and they are talking, and you can assess them so that they don't develop any hemiplegia or weakness or stroke. And when I do them awake, so they're all the way awake through the surgery. And then at the same point, when you combine minimally invasive neurosurgery with awake brain tumor surgery, then what we achieved was actually a milestone in the 75 history of Pakistan, and that was the patient. Now I've basically introduced what is called as day case glioma surgery. That means brain tumors that could be taken out without disrupting a patient's life, and they could go home the same day. And I think I'm quite...
What I'd like to understand is, when it comes to brain tumors or any tumors, a lot of apprehension is there that there could be metastasis of that tumor, or there could be small remnants that still remain within the area as well. How delicate is a surgery, and especially a brain awake surgery, and then you let the patient go? How important is the pre-preparation of such a surgery?
Oh, yeah, so that's very important. So the reality is you have to prepare the patient quite significantly. You need to make sure that they understand that they'll be undergoing the surgery awake. It takes a lot of counseling, and patients, of course, like the way I am, I'm quite like a chatty person. I'm quite friendly to my patients. So I take them through the procedure I tell them this is how we're going to do everything. I'm actually, half the time I'm not joking as such, but making them laugh during brain tumor surgery as well. And the patient that I did last time, most of the patients are doing something. The last time I asked him, because it was like 14th of August, I asked him, Pakistan ka matlab kya hai? He said, La ilaha illallah. So this is how and the other thing that, there's a two-tier answer. So the other thing that you said, of course I counsel them, then post-operatively I see them, and then they get a CT scan of their brain as well, 4 hours after surgery, to make sure everything is perfect and hunky-dory, everything is clear. If that is clear, then I speak to the patient, I make them walk around in the hospital, they're feeling comfortable, they want to go home. Of course, everybody wants to be in home rather than in the hospital, including me. It takes a lot of preparation for these kind of surgeries, and inshallah, the aim is that we're going to take day case glioma surgery forward so that it becomes like something that people don't take it like a big thing that, oh, I've got a brain tumor, oh, what am I going to do, what's going to happen? Not like that. So you come to me, you're going to have a brain tumor. Most likely, in majority of the cases, you go home with minimal risks because we are doing it awake and we are doing it as a day case.
But Dr. Saab, this brings to mind another very important question. When and how can a person realize that he might not be or might be having some symptoms of what you call a brain tumor? What are the symptoms that should make any person, realize that he needs to go to a doctor, to go to a neurosurgeon or a neurophysician, and to have himself examined?
Yeah, so the reality is there are certain symptoms. For example, I tend to do like lots of brain tumors various ways. I take them out through endoscope, through the nose. I take them out through this was like glioma surgery, the brain tumors which are taken out from the top of the head. But what happens is that most patients tend to present with headaches which are not settling. They tend to have blurred vision. Their vision is not right. They tend to feel sick or they vomit. And that's kind of a vomiting that does not get better. And if your headache is not settling on normal medication, if your headache is getting worse gradually, I think, and your vision is not better, then I think these are the symptoms you need to see a doctor. Any doctor,
All right.
that could be, you could go to ER or any doctor, and once you see a doctor with these symptoms, most likely you're going to get a CT scan or MRI of your brain, and that will diagnose what is actually going on. And then from there onwards, then of course, depending on what they are looking for, most people tend to get referred to neurosurgeons or they see neurosurgeons.
All right, Dr. Akbar, uh, are brain tumors or other tumors genetic in nature? Is there are some other predisposed conditions that lead to tumors that people need to be aware of and prevent themselves from?
So I'll tell you exactly. So there are certain types of tumors which are related to genetics, but majority of brain tumors that I see are not related